Hello friends, now we will continue with the same topic. I am Dr. Mohammad Kaleem Khan, Professor Department of Forensic Medicine, JN Medical College, AMU Aligarh. We will continue with the same topics, that is injury, and in that we will come to the second classification of the mechanical injury, that is bruises. It is basically the same, in the same definition we can say that we have various factors that will be counted, that is definition, what is the bruise, then the classification of the bruise, characteristics of bruise, factors modifying it, different factors will be there, color changes, how the bruise changes with the time and the color changes and how it comes to normal, and the age of bruise. As per the color changes we can say the age of the bruise, and medico-legal aspect of the bruise, again the same aspect we are dealing with it. In injury reports we will deal a lot with it. Most of the medical officers are not able to identify the age of the bruise and the color of the bruise. So we will be coming out with all the various aspects of the bruise and its occurrence, its age, and how can it be identified, how can it happen, what are the different types, how it happens, how the body reacts to it, how the law and the court interprets it. This is the somewhat type of bruise which we can say that this is, you can see the skin is intact, but we can say, we can see here very clearly that there is something which is greenish here, reddish here, and all the changes are going on, but there is something collection of the blood beneath the skin. This is, the skin is intact. Most of bruises are supposed to, skin is intact deep. Sometimes it is just within the deep of the skin. Sometimes it is very deep into the organs, that is called contusion. So bruise and contusion are all same thing, but contusions are in the deeper level. Definitions: bruise is an effusion of blood into the tissue underneath the skin due to rupture of blood vessels. Blood vessels, arterioles, venules, and there is a collection of pooling of the blood in a particular area, and that pooling of the blood is then further goes into the factors of clotting, and then clotting, then dissolving, then rearranging and becoming normal. It's a natural phenomena, but the major thing is that it is caused by some of the blunt forces which rupture the blood vessels and the tissues there. The ideal condition for the formation of bruise is that the epidermis should be intact, means it doesn't come out. It is just below the skin and we are able to feel it. When the effusion of the blood is in other tissue and the organ, muscle, lung, etc. is called contusion. Then it is not below the skin, somewhere else, like it is in the organs, muscles, lungs, heart, brain, etc. It is called contusion. Means it is somewhere deep, not below the skin, somewhere deep inside the body. Although often combined with abrasion or laceration, bruise generally doesn't happen alone. It is basically, it happens with somewhere there may be abrasion on the surface, bruise inside deep, there is a laceration, and there is a bruising on the lateral side aspect, on the deeper aspect. So a pure bruise lies beneath an intact epidermis and consists of extravascular collection of blood that has leaked from blood vessels damaged by mechanical impact. Mechanical impact, it means a force which is applied from outside. It may be blunt, it may be hard, it may be sharp but not very sharp, but most of the time blunt object. An extravasation of blood that is arbitrarily larger than few millimeter in diameter, it is usually termed as bruise or contusion. Again the same language. The size, this size overlaps the older and now the little used term ecchymosis, which is earlier a small bruise. It can be ecchymosis, can be said that a small bruising is called ecchymosis. Now the ecchymosis is generally not used. We have broader term that is bruise or contusion. Classification of the bruise, it can be intradermal, it can be subcutaneous, it can be within the dermis, within the skin, it can be below the skin, or it can be deep. So we have deep bruise, we have subcutaneous bruise, which is below the skin, and we have intradermal also. Intradermal bruise, which impact is patent object. Most of the time, intradermal bruise are generally on the tissues which are supported by some of the hard object like bones and all that. So tissues most of the time get crushed and the bleeding comes, but bleeding happens but doesn't come out of the skin. So hemorrhage lie in the intermediate epidermal, subepidermal layer. Within the skin layer, as I have shown in the previous lecture, that there are different layers of the skin. So in different layers of the skin, the blood is collected, but it doesn't come out. The pattern may correspond to the form of the object or the weapon, causing it like whip, canes, bicycle chains, whips that we use for whipping the horses. Canes are generally used in the fight. We can see the tram-like appearance of the cane, two lines on which there is a breaking of the tissues. And the bicycle chain can be used for fighting. That can lead to internal bruising also. Blood extravasation is small. Intradermal is very small extravasation of blood. Faster resolution, since blood is very small amount, so it will dissolve easily. Analogous to pattern abrasion that we discussed in the yesterday's lecture, pattern abrasion. Similarly, we have intradermal bruise. We can see in the slides that there is a intradermal bruise which is just below the skin. It is because of the punching. You can see there is a intradermal bruise. Here we have pattern bruising, which has very much clear to the tire marks, which causes this. Tire generally suck the tissues, and due to sucking, there is a pressure on the margins which comes in the contact of the grooves. So at that point, there is a breaking of the tissues internally, and the blood is accumulated. Similar thing happens with the canes also. The two margins of the canes which leaves the bruising. Here we can see the tire marks against, or you can see the boot marks. Here it is a boot mark. The pattern of the sole is here. Sole is present here. So we can see that it is supported by hard tissue, that is the skull. It is supported by the rib cage. So we can get the bruises which are intradermal. Subcutaneous bruise, it is usually a bruise from blunt force. It is situated in the subcutaneous tissue. It means it is below the skin. It is somewhat blood at the edge and raised above the skin. It means the collection of blood is there, and at its head it's raised the skin. The skin is here. It has raised a little bit. So we can say that there is a collection of blood, but it is below the skin. It is somehow blood due to the perfect. Most common types is, you can say most common type, it is very common in nature because skin is a blunt force which generally leads to the deeper injuries as compared to the subcutaneous intradermal tissues. So intradermal within the skin, subcutaneous below the skin. It means there is an injury somewhere in muscle or something deeper than that. Deep bruise, delayed bruise, we can say deep bruise, that is which is situated within the more than the subcutaneous deeper structures, bleeding just above the muscle or between the muscles bundle. Yani it means bleeding is in the muscles or somewhere deeper than that. It may takes hour or 1 to 2 days to appear in the surface. It may migrate up, or it may cause generalized swelling of the part, but it may migrate up. Blood can ooze out. Detection by infrared photography, which is another technique. We can say that we will come to it later on. Medical legal important is negligence of doctor. Doctors generally not able to identify it. Sometimes the collection of the blood, suppose the kidney there is a bruise, therefore there is a spleen there is a bruise, or there is a psoas muscle bruise, or any deeper structure bruise, which generally is not detected unless and until you will go for ultrasound and all that investigation. You can get the collection of the pocket of the blood, which generally doesn't come out, but there is a bruising of the liver, and bruising in the heart, lungs. It all can happen and can lead to collection of the blood in that cavity also. So you have to go in the deep investigation and thorough examination for that. Most of the time doctors or the examiners generally ignore the complaint of the patient. Complaint should be, or history should be taken very seriously, and we have to go through all the aspects of the injury that can be caused. Sometimes injury happens somewhere else, blood migrates to somewhere else. So we will come to that, but as a forensic pathologist or a forensic medicine person, I am very much concerned. That is, it is most of the time clinicians or the medical officers don't able to recognize this injury. If the injury has a fight has happened, something quarrel has happened or assault has happened, and people are not coming to you for the injury report or the for the treatment, we are not able to diagnose it, we are not able to palpate it, we are not able to get to the point. So we are doing some sort of negligence because the patient doesn't know what is inside the body going on. So we have to evaluate every aspect, including history and examination. If we need it, we should investigate also and give the proper treatment or prepare proper medical legal report. We will come to that in the coming lectures about how to prepare the medical legal report of the injury. That is also important. This is the deeper bruise. Characteristics, it may always be present on the site of impact, may not always present. It can move somewhere depending upon the gravity or the plane of the muscle. I will tell you in the coming lines. The greater the force of violence used, the more extensive is the bruise. It's clear. The more the violence is, the more extensive is the injury and more extensive is the bruise. Is spread due to continued extravasation and consequently occupies the wider area. If it is, there is a loose tissue like in the face or some in the abdomen, the oozing is going on, has happened, oozing is going on, and the collection of blood is going on. So it is not possible to assess the area of impact and severity of violence in such cases. Sometimes the gravity plays the role, like the injuries in the skull. It may happen here, but the things may migrate here or migrate backwards. Injury in the psoas muscle can lead to accumulation of the blood in the ground or the knee point. So this is because of the gravity or the plane in which the muscle or the fascia is there. Factors modifying appearance of the bruise, site of the injury, very important, vascularity of the face, of the part, Vascularity is very much important because the more vascular area is, the more chances of bleeding is there, more chances of formation of bruise. Like in the face, very vascular and very soft tissue. So it is important, very chances that the face, in face the bruise may happen very easily. Age, extremes of age, like in children the bruise may happen very easily, and in old ages it can happen very easily. Sex, in females the bruising can happen very easily. Color of the skin, here it plays a role because in India we are dark colored people where most of the time bruise, we miss the bruise because of the color of the skin, whereas in the white colored people it is very easy to identify the bruise. So we have to pay more attention for finding of the bruise. Natural diseases, some of the natural diseases can cause bleeding like atherosclerosis, blood dyscrasias, liver cirrhosis, can they all cause bruising this spontaneously. Then we have to look into that cause also. Shock, if a person is in shock, bruising may not happen. Gravitational shifting of the blood, that I have told you earlier, that it can lead to gravitational shifting of the blood or the bruise. We have examples of this. Raccoon's eye and battle sign. It is raccoon's eye is that blood has, injury has happened somewhere else and it has migrated to the through the fascia scalp into around the eye. That is called raccoon's eye. Similarly, if it has migrated back to the mastoid process, then it is called battle signs. Embobbing, bruises are more prominent in embobbed bodies. Embobbing, that bruises enlarge in size in embobbing because of the more pumped up fluids. This is a battle sign behind the mastoid. You can see there is a bruise or accumulation of the blood. Similarly, we have raccoon's eye, accumulation of the blood around the eyes. You can say that in the emergency or the casualty, we can get a lot of cases of head injury, but they are presenting in like a injury to the eye because of the raccoon's eye. Blood has migrated from the place of injury to the eyes, and you will get a lot of emergency call for the eyes. But the injury is somewhere else. Injury has happened here, and the blood has migrated and accumulated around the eye. You can get a lot of emergency call from for the eye, but actually the injury is somewhere else. But the eyes get accumulated with the blood, the eyelids, and the tissue around that, and it can present as the emergency to the eye. Color changes of the bruise, it is very common with the age of the bruise. If we say that color changes of the bruise is red, from starting from the red, because the hemoglobin is at the start, it is red immediately after infliction. Dusky purple black, fairly fresh, 1 to 2 hours or 1/2 hour to 8 hours. Blue colored, it happens 4 to 8 hours to 4 days to 2 weeks, up to 2 weeks blue color. Green up to 3 weeks. Yellow up to 3 weeks, 7 days to 3 weeks. It is a great variation depending upon the amount of blood, depending upon the activity of the body, healing activity of the body. It also great variation, but we have accumulated into some days or weeks. It disappears in 1 to 4 weeks. It can disappear in 1 week, it can prolong up to 4 weeks. But we can be able to get a timeline of something like that. We will show in the later slides. Like here, the moment of injury, red bruise, oxygen rich, blood under the skin. After that, few hours later, dark red bruise, blood darkens as it loses oxygen. A day later, dark purple bruise, no oxygen in the blood, red cell begin breaking down and iron is released into the area. Second, and then already healing process has started. First stage healing, green edges, green edges that I have already shown in the previous slide. You can see the green edges that is started healing. It will move to the center. First stage healing through breakdown of hemoglobin. Then the last stage we have yellow edges caused by the breakdown of bilirubin. This stage is the final stage. Then fading away. It faded and is sped up with vitamin D. It's speeded up with vitamin D. So we can see that red, dark brown, dark red, we can go to blue, then green, then yellow edges, then fading away. Similarly, we have different and antemortem bruise and postmortem bruise. Sometimes we can say that it is important that we have to identify that an injury has happened before death or after the death. If it is before death, the changes will be different. If it is after death, changes will be different. So we have tabulated it. Traits, causes, postmortem staining due to distillation of blood, dilatation of blood vessels in the dermis. Postmortem staining, it means postmortem staining, we will see that it is a accumulation of the blood after the death in some areas, some of the veins. Where the bruise, there is a rupture of the blood vessels. So it is very clear that in postmortem staining, there is a collection of the blood in the veins which are not disrupted, which are very much intact, whereas in bruise, there is a rupture of blood vessels. It is very clear. Site seen on the dependent part of the body in postmortem staining means it depends upon the gravity where the blood can accumulate and go there, whereas in bruise anywhere where the injury has happened. So appearance, no elevation in the blood. In postmortem staining there is no swelling or the appearance, like there is no like this is no like this. It is very much straight, whereas in a bruise it is like this. There is a swelling, the skin is like this, and then it's composed. There is a swelling in the hair. But in case of a postmortem, there is no swelling. It is just accumulation of the blood in the veins. Whereas bruise swollen due to extravasated blood and edema. Epidermis not abraded. Epidermis may be abraded. It is postmortem staining is generally a gravity phenomena. If a body is kept lying, body most of the time blood will pool on the under surface of the body, which is in the contact of the which is near the contact of the surface. Margins clearly defined in postmortem staining. Margins clearly not defined in postmortem in bruise because of the healing process. It merged with the area. Color uniform bluish purple in color. Color changes will be seen in the bruise because of the healing process on incision. Blood is seen in blood vessels which can be easily washed away. You can very easily, if we are given a scalpel and we are ready to cut it, in postmortem staining you will see that there is a blood is in the vessels and we can wash it because there is no clotting mechanism going on, because after the death there is no clotting mechanism going on, whereas in antemortem bruise or bruise which is just before the death or days before the death, there is a clotting mechanism going on. So extravasated and clotted blood seen in the surrounding tissue which cannot be washed away because of the formation of the clot and its mechanisms. Effect of pressure absent. A little pressure over the area a little lighter over the pressure can change the shape also here. Artificial bruise, There we have another malicious activities, that artificial bruise can be created, but it is artificial because of the can be created by some of the irritating of chemicals from the that are derived from the various plants like marking nuts, calotropis, plumbago rosea. They can all, when they are come into the contact of the skin, they can cause chemical reaction and cause similar phenomena of accumulation of the fluid and the blood and the to the site. It can mimic the bruise. So artificial is just because of the nuts, marking nuts, calotropis, plumbago, whereas true bruise is because of the mechanical force or the trauma. Dark brown in color, where it is true bruise, color changes. Well defined margin in artificial bruise, trauma bruise, we have merged with the surrounding areas. But another very important phenomena is due to the allergic reaction in artificial bruise, we can find vesicles filled with fluids, whereas in trauma bruise, mechanical force bruise, it is absent. Redness seen in the surrounding of the skin, redness in the site of the injury. It is because site of the injury there is a accumulation of the blood. Here it is mainly the allergic reaction. Itching present, it is itching present because of the allergy. Here itching is not present in the true bruise. Then we have another mechanism, another slide which helps in the understanding the how the healing process happens. The from hemoglobin to biliverdin to bilirubin. It is the bruise to heal, from bruise to healing. Then another chart shows that red 0 to 2 days, blue and purple 2 to 5 days, green 5 to 7 days. It means almost in 1 day, 1 week you can say that there is a greenish boundaries are appearing and the healing process starts. Yellow 7 to 10 days, brown or the normal to 10 to 14 days. No further evidence of bruising 2 to 4 weeks. After 2 to 4 weeks, that is after 14 days, we can say that bruising has not happened or all totally healed. You can say, see the picture here, the healing of the bruise is going on. So bruise is very traumatic phenomena and it heals as by the body's own mechanism. So it is a time bound phenomena of around 2 weeks. So we should be very much keen in examining the body and we must be very much keen in determining the age of bruise so that we can determine the time of injury and we can determine the impact of injury, we can determine the other factors which has caused this, which are the mechanical force. Mechanical force is the types of the weapon, blunt force, tire, boots, and many of the things that can cause bruise. And we have to look into it, and we should be very much aware of these injuries happening to anybody. So there are, we can confuse with that also. Differential diagnosis, we can say that is Mongolian spot is there, one of that is a birthmark, but we can misdiagnose it with bruise. Other moles and all that we should be reading the material on that. Bruises, medical legal significance, identification of the object causing the bruise. Age of the bruise can confirm or refute the story of the victim. If that's why I was saying that age is important. We can say that if a person is saying the injury has happened 1 day before, but you can see that the bruise is already 3 to or 4 days old. So the history is not coinciding with the examination. So I most of the time I tell my students that history is most of the time may not be correct. We can take some of the things from the history, but the actual examination is very important. You have to see the victim, see what is happened in the body. Most of the time we don't see. If we don't see and rely on the patient's word, we can be leading ourselves into a trap which can lead to punishment also. So this, we should be very much aware and very much conscious in seeing the patient. If you have not seen the patient, don't prepare a report. It is very, don't prepare a report without seeing, without examining. Distribution, another child abuse. Child abuse, we will take it in another class. We have different types of bruise. Butterfly bruise, generally it happens with when we just like this, is pulling the child's skin like this. So this is a bigger bruise and this is a smaller bruise, that is a penny bruise. Then 6 penny bruise, 5 bruise, 5 point here, and this we can grab the child from this thing, then we can get 6 penny bruises. Or manual strangulation, we can get 6 penny bruise in manual strangulation also. 1, 2, 3, 4. Then the 6 penny, 4 here and 1 here. So 5 or 6 penny bruise in manual strangulation. Sexual assault, bruising or on the inner thighs. It means the parting the thighs, you can find the bruises of the fingers that are causing it. Manner of production or self-inflicted, very rare, accidental, very common. Now the Western UP, as I am going through, the self-inflicted injuries are very much common to implicate someone. So we are going on this and we will be coming up with some good studies on that. So we have to, when you medically evaluate degree of violence, cause of injury, time of injury, direction of the force, shape and size of the injury, shape and size of the object that has caused it. So we have a lot of work to do on the bruise and the abrasions and the lacerations, other injuries. And as a medical officer, we should be aware that everything is there in your front of the eyes. We have to study first and then apply first, then re-study, then apply, then re-study, then apply, until we master it. Thank you very much, and we would like to continue on the second topic, that is laceration, on the next lecture. Thank you very much.